My name is Dr. Clement. Good afternoon. Today I'm gonna be talking about a very sensitive topic called addiction. First of all, this is a problem of a neurotransmitter that is called dopamine, a pleasure neurotransmitter. It is actually secreted by dopaminergic neurons. And these dopaminergic neurons are in a particular area in the brain known as substantia nigra. It's part of the basal ganglia. I'd like to, when I say dopaminergic neurons, I take it that a nervous system consists of a fundamental unit known as a neuron. But today I'm going to speak about a specific neuron, a dopaminergic neuron, which is found, as I say, in the substantia nigra compactum, which is right in the cerebrum, and right inside the cerebrum, connected to the midbrain. And this is a group of nuclei. They're called basal ganglia. So this particular one is dopaminergic. Dopaminergic, it means when it is activated, it releases dopamine, which is a pleasure hormone or a pleasure neurotransmitter. And this is one of the saddest things that has happened to whoever experiences this. It doesn't matter how a stimulant was introduced to this person or a drug was introduced to this person. It doesn't matter whether it was because of peer pressure, whether it was because of a senior person giving you this. It doesn't really matter. The crux of the matter is it has happened. Dopaminergic neurons have been activated and they release this dopamine. Now, this one event is an initiator of a number of events which are following. Because if you took it maybe last night, in the morning, it has gone. And the body wants it, wants the same pleasure. So it is always a recapturing of a past pleasure. It's always a recapturing of that. Recapturing. And this is sad because there's no way that it can stop without intervention. Intervention would be, rehabilitation centers. And it is very crucially important, even when there's abstinence, still it continues because addiction is actually a chronic condition. It goes on and on and on and on and on. It's a chronic condition. I have a very good example, that of cocaine as a stimulant. Cocaine will change this area of the brain and change it. First of all, When we say dopaminergic neurons, we say dopamine. They actually release dopamine. Now, dopamine, what does it do? Dopamine, there are two, it has got to act on receptors. And which receptors have been investigated and found to be there? It's D1, D2, D3, D4, D5. Now, D1 is excitatory. If that one is activated, it's going to excite the nervous system, excite the person. If D2 has been activated, D2 is inhibitory when D1 is excitatory. So D2 is going to inhibit, even the good things are going to be inhibited. For instance, inhibition of self-control, inhibition of judgment, inhibition, so you can't judge things properly, inhibition of cognitive or thinking process, inhibition. It inhibits, judgment. If your judgment is, if self-control is inhibited, actually, the drug works against, it damages the judgment circuit in the brain. It damages the thinking circuit in the brain. It will damage, as I say, it damages the self-control. So it damages the circuit in the brain. There's a circuit in the brain which is just there for self-control. Now, self-control circuit is actually damaged because of the drug. Well, in this case, I'm using, the stimulant known as cocaine. Some people call it rocks. So, I have one example of this. This is actually a fleeting pleasure. The patient is chasing a fleeting pleasure. The patient is trying to recapture a fleeting pleasure. So in other words, the patient is not going to really succeed in getting this pleasure and get it and chain it down and say, so it's fleeting, it's a fleeting pleasure. And that is why there has to be repetition. There has to be recapturing, because it is a fleeting pleasure. And this is the sad part of it. Some people, they get saved from this because of some risk factors which have been observed. There are risk factors and there are also protective factors. Protective factor would be a parental guidance, monitoring of children at home, monitoring. That's protective. It makes me think of a situation that I once saw. This guy growing up with me and being raised by a grandmother, and the mother away in a working place, being raised by a grandmother. And this is the boy, and the grandmother was in fact suffering. This was a poor family. It was coming from a very poor family. You know, one of the factors which contribute to drug addiction is a poor background or a poor community. A poor community. That's a risk factor. It's a risk factor. Because a person coming from a poor community is going to accept anything that's offered, bad or good, is going to accept that because it comes from a background of the have-nots. So this guy was coming really from that kind of a background. For instance, food would be a problem at home. And now, if there's a home in the village that is busy cooking this homemade beer, they call it mqomboti. Remember, that is fermented. Remember, that is going to produce alcohol, so to say. So there's alcohol in it. So this young boy would be offered this. He didn't have anything to eat at home, nothing. So he would accept. So now he becomes a victim of a situation. He becomes a victim of circumstances because he doesn't have anything to eat at home. He can't say no when he's being offered this African beer. So I'm trying to say there are risk factors. There are also protective factors. You know, if a person comes from a good background and what is important now is he doesn't get into drug addiction because of the background as such. All right, it can have an influence, the background. It can have an influence. But if peer pressure becomes a problem to this one who grew up in a very good environment with parental guidance, monitoring everything and all that. But if he yields to peer pressure and he takes this drug, he is just the same as the one who is coming from a poor background. It's just the same. Because what they have done, there has been an activation of dopaminergic neurons. And once dopamine is deposited into the limbic system, the pleasure system, if it's deposited it's deposited like that, what's going to happen is a recurrence now. There must be a recapturing of a fleeting pleasure. A fleeting pleasure. A recapturing of what is this going to do? This recapturing on a daily basis, recapturing of a fleeting pleasure. What's going to happen? The patient is going to get used to this, taking this. The pleasure will be transformed now because the patient starts tolerating, developing what is known as tolerance. Instead of a 10 milligram tablet, he's going to need now a 20 milligram tablet to get the same effect. In other words, to get the same clinical remission. He has developed what is known as tolerance. And this is the cause of addiction. Because now he needs it more frequently. The same drug, he needs it more frequently. And at the same time, he needs a dosage that is higher than the initial one because he has developed tolerance. And tolerance gives rise to what? To addiction. Now, what we need to find out now? Should I now come against my daughter, my son, my cousin, my niece, my nephew? Should I come with 95 sledgehammer blows at the most flagrant evils of my weak son? of my weak thought? What must I do? What kind of environment must I give now to this? Must I give a supportive environment? Or must I come with all my criticisms against this? Remember, we are talking about a patient here with well-established brain areas which are damaged. Some circuits are damaged. A control circuit is damaged. A judgmental segment, a judgment area is damaged. So we're talking about now a patient who's got a brain damage. And this is important, that we should regard this as a brain damage and treat it as such. We cannot say a patient is not a patient. A patient is a patient, because now we have to look at the condition of the patient. Well, people have got different, people are fed up with the behavior. I mean, a lot of things are being lost at home. The items, important items, because the judgment of this patient is damaged. The judgment circuit in the brain is damaged. The control circuit in the brain is damaged. So now, the decision-making circuit is damaged. To make a good decision is completely out, because the patient has got circuits in the brain which are actually damaged. And this is important. You know, I have this example that I want to use. There was this couple. This couple, they made a joint account. And at the bank, they decided, oh, look, whenever, since it's a joint account, whenever you do something as my wife, it's gonna ring. When you do something as the husband, it's gonna ring at the wife. So to give you an idea that something is happening to this account, because sometimes it can happen that your card has been stolen by someone and is busy now trying to get money from your account. So we're gonna do this. So one time, this guy was out and he was using a lot of cocaine. There's a big problem with cocaine. Like I say, it is a fleeting pleasure. The high of protein of cocaine is very short. And so this guy had to go to the bank now and again, go to the bank now and to the ATM now and again, go to the ATM now and again. And it was ringing. And then when he gets home, the wife is asking, what happened? What is happening to our account? Is there anybody stealing money from our account? What's going on? Only to find out, no, it's because of cocaine. It's because of cocaine. What is happening? There are D1 and D2 receptors. And D2 receptors are those of inhibitory. So there's no inhibition. There's no inhibition on the part of the guy. He goes again and again and again and again and again. And also, the high of cocaine is very short. And so he has to go again and again and again. And so the D2 receptors are gone. The D2 receptors, I'm talking about the dopamine receptors. Type 1, 1, 2, 3, D1, D2, D3, D4, D5. So D2 is gone. So there's no inhibition. He goes again and again. He goes again and again. He goes again and again. So this is important to understand. And this is the type of thing that needs to be discussed with all people who are victims of a situation like this, so that they should understand that a rebuilding of those D2 receptors would be a good idea. How do you do that? Rehab. If you go to rehab, you're going to abstain from taking this, and you're going to be given treatment to make sure that you don't withdraw. You're going to give in treatment so that you don't withdraw, whilst building your D2 receptors, building your inhibition. Your inhibitory circuits are being built. And that's important to understand. It's important to understand. And I think instead of chopping the heads of our patients, we should recognize the fact that they are patients. Snazo, you're a patient. And I'm glad you made a presentation on TV. I'm glad you did that. We owe you a lot to apologize to you for the type of treatment that you got, even if it didn't come from us. But as a community, we were supposed to give you a service. We didn't render the service that we were supposed to give, to give you support, because you need support so that you can rebuild those D2 receptors, those inhibitory receptors. And that's important to understand. You must remember, not everybody knows that, but now you know that your D2 receptors need to be built. They need to be built. In other words, so that there should be inhibition. When dopamine is released, it should be inhibited. In other words, you don't get this urge to go and use. Of course, we need to understand that this is a chronic condition. Even if you have abstained for a very long time, you can still fall back. What happens? And you should understand now that it's because your control circuit has been damaged. And it's difficult to, your control circuit. We should understand from our side, as people who are managing these patients, we should understand that we should not punish them. We should understand that this is a chronic condition. Being a chronic condition, because it is difficult to rebuild those D2 receptors so that there's inhibition. The control circuit is gone. The decision-making circuit is gone. The judgment, it doesn't have look, how can you take the money, the last money that was going to be able to feed your children, and take it and use it, with drugs? No, we understand now. And that is why it is important for you to also understand as a victim, to understand that you need to be helped. You need to come for help so that you can go to a rehab place. Government has some rehab places, and private, though they're expensive, but they do have. But if there's some intervention in this crisis situation, if there's some intervention, that would be wonderful, because know now that dopamine is a pleasure neurotransmitter. And dopamine, the release of dopamine for the first time, could have been a mistake, or it was unfortunate that it was done. It does not matter how it came about. It was because of maybe a chaotic home or something. If it's a chaotic home where there's no supervision, children are not well supervised, it could be. That's a risk factor. A chaotic home. I know in our townships, There are places called, shipping. Sometimes the shipping owners are parents, and then children are exposed to all this. So supervision becomes a problem. So we don't know. But a chaotic family doesn't matter what has made the chaos. A chaotic family can give rise to some laxity, such that children become victims of a situation that they can't control. Sometimes it's peer pressure. The parents are doing well. Sometimes it's peer pressure. That peer pressure, they yield to peer pressure and they end up taking. Sometimes it's a social occasion, just a social occasion. In that social occasion, that one day becomes a mistake, and you take that one day, it becomes a million other days. It means a day now after, you just day after day now you have to take, because what are you doing? You're trying to recapture a fleeting pleasure. This pleasure is fleeting. It's running away from you. It's fleeting pleasure, and you're trying to catch it. And the only way of doing it is to do it again and again and again and again and again. And the sad part of it is when you start tolerating it. When you start tolerating, now you've got to increase. You've got to increase the dosage. When you're increasing to get the same effect, of course, you're not getting a better effect. You're getting the same effect. That's why it's called tolerance. You're getting the same effect, but you have to increase the dosage. And what does it do to you? Addiction. It causes addiction. The fact that even when you want to abandon this, say you want to abandon this habit, you now realize that it has cost you a lot. You have lost your family. Family members don't want you and all that. You have lost your family. When you have lost your family, you want to leave this. You realize that this is bad for you. You realize. But then still you can't, because the chasing of a what? Of a fleeting pleasure. Now, this pleasure is transformed. It doesn't become a pleasure anymore. I want to get back to normal life. I want to be normal. To be normal is to take the drug. To be normal. And that's sad now. So the pleasure is not there anymore, but I want normality. I want to be normal. And how can I become normal? I must take the drug. Oh, that's the sad part of it. I once interviewed a guy. I once saw a guy. Came with his family. He started sobbing in front of me. This guy, oh doc, I want to look after my family. Here's my child. Here's my wife. I want to look after them, but I can't. My first priority, is my shot. If I can get my shot, then that's my first priority. For me to be normal, I need to take a shot. For me to be normal, I need to take a shot. This is a sad state of affairs. So such a patient needs intervention. You must realize that the D2 receptors, they need to be rebuilt. The D2 receptors, they need to be rebuilt. How do you do that? Rehabilitation. Your T2 receptors, why do you need the T2 receptor? Because T2 receptors are inhibitory. Now this inhibitory circuit is damaged. And so now it has got to be rebuilt. The only way you can do that, by rehabilitating the patient so that he doesn't take what destroys those receptors, those T2 receptors. This is very important to understand. We need to understand that without intervention, let us say we don't intervene. Do you know what's going to happen? The patient will just keep on until the patient dies. There's no other way, because he's busy destroying all the brain circuits that he's having. This is one of the, lessons that we should take. Snazo, you are wonderful. You are wonderful. What we need to build you up. You need to have people who come with protective factors. Like your grades. You've got higher grades. When you have got high grades at the university or tertiary or anywhere, you've got high grades. That is a motivating force. Higher grades. You've got high grades. And that's a motivating force. It means you can do something. That's a motivating force, which will make you at the end to forget your problem. That is your drug addiction. You start concentrating. Some people, they take drugs to feel better. Some people take drugs to be powerful. Like, for instance, there are uppers. Like cocaine. That's an upper. It's an upper. It ups you. It makes you feel powerful. And you want that powerfulness all the time. You want to look powerful. You want to be energetic and all that. You can do anything. No. If you have to use a drug to be energetic, that's the worst thing that can happen. So really. So some people, they want to feel good. They want to feel good. Like when you are energetic, you feel good about yourself. You can do things, right? When you are, some, they take it to feel better. Some of them, they take it to concentrate on certain areas. I know of guys who took drugs to be able to be wonderful mathematicians. They would concentrate. It would make them concentrate. It would make them that kind of thing. But then, what are you doing at the end? At the end, you are going towards your grave. I mean, really, there's no way that you can keep on like that, because dopaminergic neurons are not to play with, because dopamine is the pleasure hormone, and pleasure hormone, you don't want to be busy all your life chasing this fleeting pleasure. Thank you very much. Thank you very much.